looking at other experts speaking on different various topics in healthcare and AI, I thought my talk is slightly technical in nature. So I'll try to keep it much more at a higher level than getting into the details here. And I'm part of the Healthcare AI team at IIT Hyderabad. So you'll hear the academic perspective of how professors dwelling into problems which possibly you're not excited about it, but in future you may have some excitement. So one of the areas that we have been working hard is the topic of histopathology, where we have seen a lot more products that are coming into the market, FDA-approved products, but then the question is what we are doing in terms of our own setting, Indian healthcare setting, right? So we know that histopathology is the foundation of clinical diagnosis, and it's a golden standard for, say, oncopathology. And we also talk about various aspects of histopathology. We see that there are a lot more challenges that one has to overcome in terms of the technology that we are discussing today. And one of the major challenges, if you look at it, and this is simply, I just asked ChatGPT to put me what are the challenges that are there in histopathology, and it could list out some of them. And mostly what you can see there, it is sticking around the inter and intra-observer variability among the pathologists, as well as the shortage of pathologists in India. So these are few challenges which we can talk in terms of accessibility, affordability, as well as the quality of care, the three pillars that we talk in the context of Indian healthcare setting, right? So how do we overcome this challenge is the critical aspects that I'll discuss in next 10 minutes of my time. And for this, we are looking at some digital transformation, and this is what we discussed in the morning session called digital pathology, where you can take the tissue slide images that you come across in histopathology and put it in a whole slide scanner, and this is where a lot more revolution is going to happen in India, and we're already seeing so many startups are coming in the space to come up with low-cost whole slide scanning systems which could help us to move towards the traditional way of looking at under the microscope to looking at from the computer. And once you digitalize, then comes the interesting aspects of what you can do with it. So one thing we were discussing is that you can do a remote diagnosis sitting at your home, or you can send the pathology slide across to multiple pathologists who could give inferences on those slides. So in that sense, you will see that once you digitalize these whole slide images, there are a wealth of opportunities that can come with it. But the challenge is, are we ready in Indian setting? So that's the question I always keep asking, because some of these technologies that we are inheriting or we are learning about it is coming from US or UK, where the healthcare system in terms of the infrastructure are well matured. But then adoption from a microscope to a digital pathology, the transition from a microscope to a digital pathology itself is a big milestone that we have to cross. And this is where we are expecting that the technological revolution in the infrastructure will make us move towards that. But interestingly, what we are trying to do is we are trying to see if there are any way to disrupt the digital pathology space in India. And therefore, we started to bring in some of the aspects of investing some resources in digitalizing the whole slide images that are in the archival materials of the institutes which are there. And what is interesting here is once you digitalize these images, right, you'll see that there are a kind of image what you see on the screen, and this is something is called a gigapixel resolution image, which is not just like the image that you take over your phone cameras, and it has a lot more information, which is more than what you could see with your eye. And this is where you have to appreciate the pathologists who are doing this job day in and day out by looking at for a needle in a haystack, right? So this is something like you have to go over the entire tissues image that you see there and try to come up with some kind of a diagnosis which will be used in treatment planning and management of the patient. But interestingly, this kind of images are not easy to handle because it is of bigger size. It's, as we talk about the technology, I also talk about the infrastructure part of it. Are we having the resources to store and process these kind of images? And that too, if you are talking about remote diagnosis, are we having capability to send images across our internet? So you can think about several such problems once you start inheriting different technologies in this space. And also, it's an interesting image in the sense you can see this image at multiple resolution. So therefore, you have different morphological features that you can visualize and arrive at some kind of conclusion, right? So this is the kind of data sets that you will come to use it when you adopt digital pathology. And once you have digital pathology, what we are talking about is bringing in computers to interpret those images, and this is where we have been discussing about the role of AI and whether AI will replace pathologists or the pathologists who know AI will replace pathologists. So we have been discussing about all these aspects of it, and I'm telling you the flavor of what pathology will be disrupted in this space of AI in healthcare.